You are listening to The Scope, Phelps Health Podcast, Episode 13. Today we're going to be talking about birth control. Let's get started. Hi everybody, I'm your host, Paige Heitman. The Scope Podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or subscribe to our YouTube channel. You can also find Phelps Health on Twitter, Instagram, LinkedIn, and Facebook. All links can also be found in the show notes. Now let's get into our show. Today our guest is Dr. Nathan Ratchford, Chief Medical Officer at Phelps Health Hospital and a gynecologist with Phelps Health Medical Group. Dr. Ratchford, last time we met, we talked about the importance of women's health, pregnancy, and infertility, and I know that was a lot to discuss in one time period in one podcast, so today I really kind of want to hone in and talk about birth control. So if you're ready, we're just going to go ahead and dive in.
Yeah, it's a great topic.
Perfect.
Yeah.
So one of the first things I want to talk about is, when was birth control created and what was the purpose of it?
It's a complicated question.
Mm-hmm.
So
It has a really interesting background.
Yeah, so I think there's a long history actually for how human beings, science has come to terms with how to selectively and time childbirth and avoiding pregnancies and things like that. For a long time, women have recognized that there's times of their cycle that they're more fertile than others, and they kind of try to time intercourse around those times if they're trying to conceive or if they're avoiding pregnancy. That I'm sure that predates history, to be honest with you. If you're talking more about like modern options that women are seeking for birth control, so really the birth control pill that most women are familiar with, that was developed in the 1950s and it's been around since the 60s. And then over the decades since then, there's been a variety of other developments with the birth control pill and other contraceptive options that we'll discuss this morning. But as a woman seeking birth control options to prevent pregnancy, most of the options that are available today have been around for a long time.
And is that the main purpose of birth control, is to just prevent pregnancy, or are there other reasons that somebody might be on birth control?
Sure. So, these things that we're talking about, they all get grouped together because their primary purpose is to help with family planning and to avoid pregnancy if it's not desired at that time. But depending on which option you're talking about, some of these things have potential secondary benefits that a woman might be looking for as well.
So whenever you say secondary benefits, for example, some people might be on birth control because they have like endometriosis or they have cysts, things of that nature.
Sure. So just looking at the overall gestalt of things that people are looking for, I'd say hands down the most common secondary benefit that women are looking for is they're trying to do some sort of positive effect on their periods. It's a very common thing for women to have nuisance bleeding, unpredictable periods, heavy bleeding, things like that. And most of the options that women can choose for birth control will have some positive benefit for that. There's other things that are less common, like you mentioned endometriosis, ovarian cysts, acne, hair growth, things like that. Depending on which birth control option you're talking about, some of these things can help with those as well.
Now, when somebody goes in to get birth control, regardless of their age, it can feel very overwhelming because you have so many different types. So let's spend some time talking about that, because you have a pill, a skin patch, an implant, and that's just a few, and that doesn't even cover all of it.
Sure, it can be really overwhelming.
Yes.
So I will say that one of the things I've recognized over the past 10 years or so is that most women do a good job of informing themselves before they come in for their visit. The internet is kind of a double-edged sword. It's got a lot of great resources on it, but you want to stick to more reputable websites and things like that and careful what you read. So that does help with the conversation. Generally, if I've got somebody coming in asking about contraception, I think most people kind of have an idea of what they're hoping to start. I still give them the benefit of, we talk about what all the options are, the pros and cons, make sure that she's making the right choice for her. But if somebody comes in just blank slate, they have no idea what they want to do, they just aren't ready to get pregnant at that time, It takes a good 10-15 minutes alone just to kind of talk through all the pros and cons of the various options.
So do you recommend a certain contraception over any other one? Like, do you say, the pill is my go-to, or what is an IUD is my go-to?
Yeah, so not at all, actually. So,
okay, let's talk about that.
Yeah, so just like no two people are alike.
Mm-hmm.
One of my go-to sayings that I tell people is like, if I'm counseling her on her options, I say, not that there's somebody sitting next to her, but I usually point at the empty chair and I say, if your twin sister was sitting right here, she might choose X, Y, Z for whatever her reasons are, and that's totally fine. So, it's you're right. It's overwhelming sometimes to have so many options, but it's really neat to have so many options because depending on what you're looking for, what your personal preferences are, you've got a choice.
So let's say somebody chooses a contraception of their choice, whatever it is, and they decide after month 1, it's terrible, it's no good. Would you recommend them to stay on it for a certain amount of time because it may level out, or what's the protocol?
Yeah, so with the scenario you're describing is really kind of birth control pills, actually. So, currently there's about 40 or so different birth control pills on the market, and they all have different amounts of estrogen in them or different types of progesterone. And if I've got somebody who's just coming out of the dark, she's starting a new birth control pill, never been on that before, I caution people that, hey, we may get it right off the bat and you do wonderful with it, but sometimes it takes like 2 or 3 months before your body kind of gets used to it and you decide if you really like it. I certainly wouldn't want somebody to start a pill and have, really troublesome side effects from it, and then she forces herself to persist on it for 3 months.
Yeah.
But if it's more minor things, like maybe her bleeding isn't happening exactly when she thought it would be,
those things may even out.
Yeah, those things may get better with time. So.
Now, are there any types of contraceptives that don't have hormones in them that are options for
yeah,
women?
so there's essentially 2. So one option would be what I would call barrier methods. So this is going to be like we mentioned rhythm method earlier, which is where you monitor your menstrual cycle. And there's even apps on your phone and stuff like this that can help you these days. It's very simple, but if you have a regular predictable menstrual cycle, you can kind of predict which days of your cycle you're going to be more or less fertile. And then depending on what your goals are, you can either avoid to have intercourse or have intercourse on those days. Condoms have been around for a long time. Diaphragms, sponges, cervical caps, withdrawal method, which is where the partner pulls out before he ejaculates. So those are all non-hormonal. So you're not really doing anything unless you're sexually active. There's no side effects from it. Unfortunately, those are also on the less effective end of the scale, so it does come with some drawbacks.
Yeah, there's some risk associated, right?
And then the second option is the Paragard IUD or the copper IUD, which has the advantage of it doesn't have any hormones in it. It's implanted in your uterus, so you don't have to remember to do anything with it. And it's quite effective. It's about a 1 in 800 chance of getting pregnant every year, which is really good. The only drawbacks to it are if you're allergic to copper, obviously, you can't have that.
You would figure that out really fast.
Yeah, it's really uncommon, but most pennies have copper in them, so if you break out from touching pennies, you'd be allergic to copper. And then since it doesn't have any hormones in it, it's also not going to benefit your periods in any way. So women that are on the copper IUD, they typically have crampier, maybe heavier periods when they have the device in.
So for the women that are on the copper IUD, is there anything that they can do proactively to make their periods better, or just being on the copper IUD, or they just they get what they get?
Yeah, it kind of comes with it. Some people will get good results with anti-inflammatory type medications, really strong doses of Motrin when they're on their period, and that can help. But and unfortunately, it's one of those things, just kind of trial and error. You just kind of see how you do with it.
Yeah. You mentioned earlier the menstrual cycle or the rhythm method, let's talk about that for a second. So if somebody's like trying to have a baby, is that method very effective?
Yeah, so again, I was mentioning like the phone trackers and stuff like that. I don't really have one that I recommend necessarily, but you can go to the application store on your phone and find them pretty easily. But if a woman is having a typical 28-day cycle, so from the start of one period to the start of the subsequent period, it's about 4 weeks. She can pretty reliably expect that she's going to ovulate around day 11. Okay. So what the app will do is, based on your menstrual cycles, it'll calculate like this window of a handful of days is when you're most fertile. So if you're trying to get pregnant, you'll want to have unprotected intercourse during that time. If you're trying to avoid pregnancy,
leave the house,
you would have intercourse the other time.
Yeah.
So it's all what you're trying to get out of it.
Okay, great answer. So my next question is, where can somebody get birth control? We know that we can go to our provider's office or a clinic's office, but what if that's not an option for us?
Sure. So, like you said, most birth control, like what we're talking about today, is either prescribed or it's something that is ordered from a pharmacy that is sent to the doctor's office and then it's inserted at an exam. Okay. Different barrier methods are effective and they're over the counter. So you could go to any pharmacy and get things like condoms and whatnot. And then, we have other services available, like there's Planned Parenthood here in town. As far as, getting counseling for what birth control is right for you, talk to your physician and find out, what you're going to do best with.
Yeah, you talked earlier, it's really, it's neat that we have so much availability of technology in the internet, but again, that can do us a disservice because we may think we know something that is completely inaccurate and get into the meeting and say, well, I have X, Y, and Z and this is what I want, and you give us a completely different recommendation based off of that.
Yep. I'd say many times I'll have a scenario where somebody comes in thinking they want whatever it might be, but then by the time they really get into like what she's looking for and what she's hoping to get out of it, she may find something else is a better fit for her. That's okay.
Which is why we need providers to help us navigate those decisions because they're oftentimes very difficult to navigate. Yeah,
no, it's a big part of my job, both with this and a lot of other things that I do, is helping people find what they think is the best choice for them.
Yeah, you're a provider and a counselor.
Yeah, that's right. That's very true.
So let's say somebody decides that their preference of choice is the pill. Is there a certain time of day that somebody is supposed to take the pill? Let's say it's in the morning before they eat. Should they do it at night before they go to bed?
Sure, that's a common question. So really when it comes to taking the pill, the most important thing is that you take it consistently at the same time every day. We all have different schedules, and if you can honestly tell yourself you're not going to remember to take it at the same time every day for school, for kids, for work, whatever it might be, probably not the best fit for you. Some people prefer to take it in the morning. Some people prefer to take it in the evening. If I've got somebody who has never taken a pill before, I prefer that they take it at night before they go to bed at the same time, because a common side effect when people first start a birth control pill is nausea. And I may not be able to make that go away, but at least if she's already sleeping and that's the window when she would be experiencing nausea, she's not going to be aware of it.
Yeah, she's already asleep, so it doesn't matter.
Right. Food, some people like to take their pills with food, and that's okay. It doesn't affect the effectiveness of it.
If somebody doesn't take their pill at the same time, does it decrease the effectiveness?
It does. So what most women are going to experience is that their periods are not going to be as regular as they would like to have them. They're more likely to have side effects from the pill. Worst case scenario is they're taking this medicine to prevent pregnancy, and it's going to be less effective.
And then they might wind up pregnant.
Yep.
And then they have twins.
Who knows?
So are the pill and the other forms of birth control, are they safe?
Sure. So, safe is relative. There's nothing that's available to a woman for birth control right now that I would say is dangerous. Okay. Everything has potential side effects, and depending on your personal history and medical conditions, there are options that you shouldn't use. So A great example of that when it comes to birth control pills is if you're a woman older than 35 and you smoke, that's a contraindication for being on birth control pills. Being older than 35, smoking, and taking an estrogen-containing birth control, like the birth control pill, those are all going to increase your risk for getting blood clots, and that's why we try to avoid that. So, if you are in that situation, smoking cessation is just really not realistic or an option, and you really need to consider something else for birth control.
That leads me into another question that I have regarding age. So let's say somebody starts taking birth control when they're 16 and they're on it until they hit like menopause. Is that going to cause lifelong issues for them, or is it totally fine to be on birth control your whole life?
So I'd say it's sort of totally fine. So, I can't say I have anybody that fits that exactly, but I do have quite a few patients that, other than whatever pregnancies they might have had, they like being on birth control pills for whatever the reason might be. Maybe it's period regulation, maybe it's their complexion or whatever that they're looking to avoid. Women that are in their 40s, as they're approaching menopause, they tend to do really well with birth control pills for those same reasons. It's helping out with their hormones, it's helping out with their periods. People that are on birth control pills have a reduced risk of ovarian cancer and uterine cancer. So there are benefits to being on the birth control pill. There is a small risk of an increased risk of breast cancer, but the problem with that is that for the individual woman who has a 1 in 8 chance of getting breast cancer, whether you take the birth control pill for 1 year or 30 years in your example, your personal risk of getting breast cancer is unchanged. It's still 1 in 8. You can really only show that correlation if you look at really big groups of women. So,
what about parents? So as their children get older and they decide that they want to be on birth control, how do you even have that conversation? That can be really awkward, and maybe the kids don't even want to have it.
Yeah, and it's funny, like maybe once a month or so, I'll have a patient that'll be in for her Wellman exam, and they always save it for like right at the end.
So they can just boost, scoot, and boogie.
Like, hey, my daughter's 16. What do you think about this? And so I tell people, good for you for thinking of this first, because it's not a place that parents naturally gravitate to. I think the statistic is something like 40% of high schoolers are sexually active, which is a really high number. And I think most pediatricians would tell you there's good data out there that if a child is going, or in this case adolescents, if an adolescent is going to listen to anybody, it's going to be one of their parents. So I think this is going to be individualized to the child, and you're going to have to approach your child in the best way that you see fit. But I would really encourage parents to, if their daughter is not bringing it up to them, they really owe it to her to bring it up themselves and just get that over with and get that conversation out there.
So is that what you say to parents who come into your clinic at the very end of your appointment?
Yep.
And then you pat them on the back and say good luck.
Yep, that's right. So, and I know it's a very awkward thing to come in as an adolescent to a gynecologist office, but I would say when it comes to talking about like what we're talking about today, I love talking to adolescents. It's an opportunity to set them on the right track. Things that they may have heard that were incorrect from their friends or the internet or whatever, that's your chance to make that right. Rightly so. I think a lot of younger women are intimidated to come to the doctor's office because they're expecting, an embarrassing exam, and you're talking about awkward things and stuff like that. It is rare for a 21-year or younger woman to have to do some sort of pelvic exam or something like that in the doctor's office. It just doesn't happen that much. So typically what I do with my teenage patients, if they're just coming in for like this discussions, is we just sit here like this and talk. Sometimes they want mom to leave. Sometimes they keep mom in the room. It can really be whatever they're comfortable with. But, I wouldn't let that be a barrier to them getting appropriate care.
Yeah, it should almost make them feel empowered to be able to have those conversations at that age.
It's a safe place. There's there's little subtle tricks and things that I talk about that kind of put them at ease. And like I said, they're usually very good visits.
So let's say somebody is on birth control and they've decided that they want to have a baby.
Mm-hmm.
When should they stop taking birth control, and when can they expect to conceive?
So again, that's going to be tailored to the individual and what birth control they're on. So I would say the average woman coming off of some hormonal contraceptive, most people can expect to start having periods within about 3 months or so. Once you start having periods on your own,
Then you can get pregnant.
that's a good indicator that you're ovulating and you could get pregnant. This is a common question. It's tricky to time when you're going to conceive, thinking about, you're looking at the calendar for next year and like, oh, I'd love to have a April baby or whatever it is. Everybody thinks those things, and it does work out for some people, but typically a couple having regular unprotected intercourse off of any contraceptive up to a year before they conceive is considered normal. So.
Which I didn't think about this either, but you talked about that in a previous podcast as well. That's a long time, because a lot of people think as soon as you get off birth control, bang, you're pregnant.
Yep, and that does happen. Some people even accidentally get pregnant on birth control. It's not perfect. But, I would tell somebody if she's planning on getting pregnant, just be kind of open-minded, if you will. Maybe it'll happen off the bat, but maybe it might take a while.
Here's a random question too, and this is a little off the wall. What if somebody is ovulating, so they're like at really, I guess, high capability of getting, or probability of getting pregnant, and they're on birth control, they forget to take their birth control, or they take it at a wonky time, but then the next day they take Plan B. Are they still at a pretty high risk of getting pregnant?
So I would generally discourage somebody from taking Plan B on top of their birth control pill. That would be an unusual situation, I would think. So if somebody has accidentally gotten pregnant while taking a birth control, continuing that birth control, taking Plan B at that point is not going to make a difference. So,
If somebody finds out that they are pregnant, they should stop taking birth control though, right?
Yeah, so generally speaking, if somebody's taking like a birth control pill, she feels like she might be pregnant, she takes a pregnancy test, lo and behold, yep, she's pregnant. She really needs to stop her birth control pill, and she needs to call her doctor and get further instructions on what to do. That does happen, and at that point, there's really no harm from taking the birth control pill, but I would encourage somebody to continue it. That advice would be different for other things, like we've mentioned IUDs and Nexplanon. If somebody's to get accidentally pregnant on those, I would give them different instructions, but they still need to call their doctor.
What happens if somebody stops taking their birth control, but they just don't ever get their period back? Should that be a cause for concern?
Yeah, so some people resume normal periods faster than others, which is to be expected. I generally tell people if they stop their birth control that's regulating their period, so like in this example, birth control pills, if they have not had a period within 6 months, they need to let me know. We need to make sure everything's okay. Doesn't mean there's something wrong necessarily, but that would be unusual for somebody to go that long and still not have a period.
So it sounds like 6 months is kind of the marker to be like, okay, I need to call my OB or my provider, and we need to have a conversation.
Yeah, that would be my comfort zone for somebody going that long without having a period. That needs to be investigated.
Is that regardless of whether you're on pills or something else like an IUD?
So IUDs, no, because it's really common with IUDs to not have a period at all while you're on those. I think if I was to compare my patients coming off pills versus coming off an IUD, probably the people on the IUD come back quicker, to be honest with you.
Okay.
But I don't know, it's a good question.
So just kind of you just have to play it by ear.
Yeah, but for sure, regardless of what birth control you're on, if you don't start having a period on your own, you need to let your doctor know.
So why do some people take a pill, but other people use a shot or other methods of birth control?
So it kind of boils down to personal preference and your own personal comfort level of effectiveness. Birth control pills, the vaginal rings, the patches that you wear on your skin, they're all kind of an equal effectiveness, and they're kind of on the lower end, to be honest with you. In the middle would be the Depo-Provera shot that you get every 3 months. And then at the higher end of effectiveness would be the implantable devices. So this would be like the next one in your arm or one of the IUDs inside your uterus. Those are the most effective reversible contraceptives. All of those have different ways of taking them. All of them have different potential side effects. Really, it comes down to your personal preference on what you prefer.
Now, regardless of whatever somebody like chooses again, let's say that they really hate it, and I've done this. I'll tell myself I did this in college.
Sure.
I was on a pill, and I couldn't even tell you what pill it was. It was like a month in, and it was like the worst month of my life, and I just stopped it cold turkey.
Yep.
Should I not have done that?
Oh no! If you were having that significant side effects, you absolutely should stop it. Let your doctor know. Get some further advice.
Yeah, so it's totally okay then if somebody is just really having very bad side effects for them to stop it cold turkey. They shouldn't push through the pain or whatever is going on.
I mean, I don't know if this is where you're going with that, but kind of on a related note, if you're doing fine with the birth control pill, it's best not to stop mid-pack. If you're intending to stop it for whatever the reason might be, you're switching to something else, you're wanting to get pregnant, you should stop with the full pack and then go from there.
Finish it out.
But yeah, any medicine that you're having a problem with, you need to stop it and figure out what's going on.
So I have one more question, and then we'll wrap up. Do birth control pills protect against like STIs or anything like that?
No, that's a common misconception. I'm glad you said that. So all the things that we've talked about, birth control pills, NuvaRing, IUDs, Depo-Provera, so these all have different effectiveness at preventing pregnancy, which is primarily why people take them.
Yes.
It's also important that you take into account your personal risk of sexually transmitted infections, which, depending on the situation, may be relatively low or it might be high. So if you're in a situation where you might be potentially exposed to an infection, even though you're taking some sort of birth control, it's important you use condoms to prevent that. You get tested for infections to make sure that you've been exposed, but you don't have any symptoms. You want to try to avoid that situation if you can.
Yeah, and that's to protect ourselves
Absolutely.
as much as it is to protect others.
Yeah, I tell people all the time, nobody's going to watch out after your health better than you. And it's important that even if you're on birth control, who you share your body with can have health implications
that you don't know about
for the rest of your life. Yeah, so you gotta take the appropriate steps. Yeah.
Absolutely. So before we end our show, I want to give you an opportunity to give us any final advice you have regarding birth control.
No, like we started with, it's a complicated subject.
Very
There's a lot of
nuanced.
options. I would really ask, regardless of where you're at in life, your age, what your goals are, if it's something that you have questions about, if you need help making a decision, definitely reach out to your doctor. I'm sure they'd be happy to help you.
Fantastic. Thanks so much for tuning into The Scope. If you liked our show and would like to know more, check out phelpshealth.org. Thanks so much.